Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to this presentation on managing patients with chronic obstructive pulmonary disease. We will discuss the challenges and necessary precautions when treating these patients, recognizing respiratory issues early and taking appropriate measures is crucial to ensure patient safety during dental procedures. Patients with a well-compensated chronic obstructive pulmonary disease often have trouble breathing when lying flat because they rely on an upright posture to breathe properly. Therefore, placing these patients in a supine position can interfere with their ability to use accessory muscles needed for respiration. They are adapted to having high carbon dioxide level in their blood and use low blood oxygen as their primary stimulus for breathing. Administering high flow nasal oxygen can reduce their respiratory rate, potentially leading to cyanosis or apnea. As we pointed out that these patients often use their accessory muscles to breathe, which can be difficult in a supine position. Excessive lung secretions are harder to clear when lying down, making it uncomfortable for these patients. Such patients will typically request to sit up to breathe more easily and avoid complications from positioning. Providing too much oxygen to a chronic obstructive pulmonary disease patient can reduce their respiratory rate, leading to cyanosis and possibly apnea. If this happens, it is important to stop the oxygen administration before patient becomes apneic. The respiratory rate should improve once the oxygen is discontinued, but if apnea occurs, immediate basic life support and emergency assistance are necessary. Patients with a history of chronic obstructive pulmonary disease are at higher risk for respiratory issues, especially during an acute attack. Look for signs of respiratory difficulty such as the use of accessory muscles and rapid breathing. Ask patient about any recent changes in cough frequency or sputum production, as they can indicate an acute attack. If an acute attack is suspected, it is best to postpone any elective surgery until the patient has received appropriate medical treatment. In cases where emergency surgery is necessary, take extra precautions to optimize the patient's airway. Administer a prophylactic dose of a bronchodilator and consider referring the patient to an oral and maxillofacial surgeon. Now let's discuss the important points to remember for examination point. These patients often need to sit upright to breathe adequately during oral surgery. High arterial carbon dioxide levels are common. They use low blood oxygen to drive respiration. The supine position hinders the use of accessory muscles, making breathing difficult. Excessive lungs secretions can be challenging to clear when the patient is in supine position. Too much oxygen can decrease respiratory rate, leading to cyanosis and potential apnea. Discontinuing oxygen can help recover the respiratory rate. In cases of acute attack, questions patient about increased cough frequency or changes in sputum production. Postpone elective surgery until proper medical attention is received. For emergency surgery, use the prophylactic bronchodilators and consider referral to a specialist. To conclude, understanding and managing the challenges that chronic obstructive pulmonary disease patients face in dental setting is crucial for their safety. Pay attention to their positioning and be cautious with oxygen administration. Properly managing acute attack can prevent complications and ensure the best possible care for these patients. Thank you. Wish you best of luck.